A growing number of young adults in this country with personality disorders is raising all kinds of alarm bells in the mental health community right now. A new study finds almost 1 in 5 young people, ages 19 to 25, has been diagnosed with a psychiatric problem. Even more of them are abusing alcohol or drugs. Dr. Carlos Blanco is an associate professor of psychiatry at Columbia University and a co-author of the study. Dr. Blanco, what are we talking about here? 1 in 5, that sounds like a huge percentage of the 19 to 25-year-old age group.
It is certainly a very high percentage, but it is a reality, and I think it's important for the public to increase its awareness of the prevalence of mental illness and to take measures to increase awareness and to provide prevention and treatment of these disorders.
Well, mental illness like what? What's included in this list?
Well, as you mentioned, personality disorders, I think abuse, alcohol abuse and dependence, nicotine dependence, depression, anxiety. So there's a broad variety of disorders that the youth suffer and at this point are being untreated. As you know from our study, only 25% of the individuals who had the mental disorders ever sought treatment.
Bipolar disorder is one of those that, according to your study, afflicts about 5% of this age group?
Yes, about 5% of individuals 19 to 25 have bipolar disorder, and as you know from a previous study that we did, there's been a large increase in the prevalence of bipolar disorder in the U.S. over the last 10 years. We don't know the cause, but what we know is that many individuals are not being treated, and it's important to facilitate access to treatment and for people to know that treatment is very effective.
Now, this is the largest study of its kind, so these numbers aren't a function of you having a very small sample or something like that here.
No, these findings are very reliable. The instrument that we use is very solid, very reliable, and we use a very large sample size, the same that you would use for a political poll, so that we know that the numbers are very reliable.
So what are people supposed to do to get help?
Well, I think that you want to, if you have symptoms or you suspect that you or somebody that you love has symptoms, you should consult either with a psychiatrist or a psychologist or a physician for an evaluation and see if you need to get a specialized treatment. And that treatment can involve either counseling or psychotherapy or medication depending on your needs and preferences.
Dr. Carlos Blanco, Columbia University, and one of the co-authors of this study. Very disturbing. Thank you.
Thank you.
Especially when you have 3 teenagers in your house, right?
Yeah, they're getting into that age. Well, I have one in that age group, that's for sure.
You pay attention. Well, new development.